Welcome to the World of Rare Disease, a show that focuses on awareness and education about rare and complex disorders. My name is Lisa Deck, and I'm a Rare New England committee member and your host for today's show. Today, our show features Kathleen Swenson, who is an assistant professor of medical sciences and education at the Boston University School of Medicine and director of the Boston University Master's Program in Genetic Counseling. Kathleen began working with the genetic counseling program in 2010 as a course instructor and capstone mentor. She has 16 years of experience in genetic counseling in various clinical settings across many specialties. Today's show will look at genetic counseling as a career. Specifically, we will look at Kathleen's career path and the various ways to have such a career. We're thrilled to welcome you to our show, Kathleen.
Hi, thank you so much for inviting me. I'm really excited to talk more about the field of genetic counseling.
Awesome. Well, you certainly have quite a career in it. I'd love to talk to you about why you chose a career in genetic counseling.
Yeah, so genetic counseling is it really captures the opportunity to dabble in science and to dabble working with people. And it really brings those two things together so beautifully. You get to become an expert in the field of genetics, which in 2020 is becoming more and more integrated into our healthcare and into our society. And you get to really understand the impact of genetics and the technology of genetics and really what genetics means for society. But then you also get to work with people. You get to work with families, you get to work with individuals, you get to work with people across the lifespan. You get to support them during some really difficult times. You get to support them during proud moments. You get to be part of their healthcare. And it's a really rewarding place to be.
Excellent. Well, you definitely have had, in talking about your career, a variety of experiences. And I was hoping you could tell us a little bit about the different things, kind of where you got started and how you ended up here.
Sure. So genetic counselors work in all kinds of different places. It might be a hospital, it might be a university medical center, a community-based center. They may be involved in an advocacy organization, working with insurance companies, working with advocacy groups, working in laboratory or research settings. So there's lots of different places where genetic counselors can practice and can be employed. My own path started in 2000, so 20 years ago actually, and I started in the most traditional of ways and going into a general genetics office and working with patients in the prenatal space, so working with pregnant women and their partners. Their family members, working in pediatrics, so working with children and again their families, and also we had a cancer clinic at that first position as well. So it was all encompassing. And then I focused a little bit more on the prenatal space. I feel like my career has sort of gone through the life cycle of its own life cycle. And I've started with prenatal. I transitioned into the pediatric space, mostly working in pediatric neurology and supporting a department, both in clinic, advocacy, research spaces. Then I went over to cancer. So again, going through that lifespan. And then I spent some time in industry, really supporting newer technologies and thinking about other ways to provide genetic counseling service through phone-based genetic counseling provision, which at that time in 2012 was nuanced. And now in 2020, it's very mainstream given our current state of the world. And being involved in education is something that many genetic counselors are involved with since the beginning. It might be supervising a future colleague. So as graduates and you're working in the field, you might be working immediately with students or supervising them on research projects or getting involved in teaching in a training program. And so I was able to get involved in teaching at my alma mater in 2007 and then at Boston University in 2010. And then after my sort of industry dabbling, I went into education full time. And here I am as the program director of the BU Genetic Counseling Program.
Well, I think with that varied career, you got so many different experiences. And I imagine that as a professor, you bring that to your students and you also are able to advocate for them all these different career opportunities. So working in this field, what would you say is the highlight or some of the highlights of being in genetic counseling?
Ooh, being in genetic counseling, some highlights. Certainly I think being in the role of an educator, it's really exciting to foster the development and the growth of future colleagues in our field and really help them discover for themselves what aspect about genetic counseling are they most passionate about and how do they wish to get their own career started. For me, outside of teaching, being in that clinical space, it was really the people I met. It was the families. It was the lessons learned from patients. I still keep in touch with some of my patients. It's been 20 years, but I still keep in touch with some of them, even though I'm not even in the field anymore. So certainly working with that people part of this field has, for me personally, always been so inspiring and so just gets me going every day and keeps me reading all the new journal articles and keeping up on all the greatest science. And we've come a long way in the field of genetics, and there's just been a lot to absorb over the past 20 years. And so being able to work with people has just been such a highlight for me. And I think for a lot of people in this field too, they really value that patient connection, understanding, wanting to understand that lived experience, wanting to grow in that area, and really wanting to support people through thick and thin with their own journey on maybe dealing with a rare disease or a certain health issue along the way too.
Right. Well, it sounds like a perfect combination of science and probably nothing as exciting as genetics in the past 20 years of where it started and where it's come to, really. And then the combination of working with people. Now, that being said, what are some of the realistic challenges? I think there's probably so many highlights, but I'm sure there's tough days as well.
Yeah, absolutely. It's been such a transitioning field. There's been, there's been a lot of growth. And so for, the job market has been very, has been an area where there's always a lot of jobs. There's usually more jobs than there are genetic counselors in this field. And so we have experienced a bit of a workforce shortage. And many training programs have really tried to either develop from the ground up or increase the number of trainees that they train every year so that we can help fill that gap in the working world. Technology has really allowed ways in which health communication can be shared automatically. And so I think many are wondering what could be replaced, let's say, by artificial intelligence versus what can't be replaced. And certainly the counseling skills and the people skills that we bring to the table when we are working with patients and their families, that can't be replaced. So, trying to work around maybe how can we efficiently provide this service to the individuals that we work with. And I think, of course, insurance has become a barrier for some. I think we all experience to some extent the issues of health insurance and sometimes the restrictions that places on us, or maybe there's lack of access to a local provider and you might have to drive a certain number of hours to get to that provider. But again, I think with telehealth and telemedicine, there are ways to certainly work around that.
Right. Yeah. Those are all very valid challenges that I'm sure, impact daily work. So genetic counseling, can you tell me a little bit about the education path it takes to get there?
Yeah.
I'd love to hear about that because we're not sure what that means.
Yeah. So individuals who are interested to pursue graduate training in genetic counseling generally have some type of background in science or some type of background in working with people. So many individuals, generally a college degree is required to enter a genetic counseling training program. And again, many students with a bachelor's degree focused on biology as their major. We see a lot of neuroscience as their major. We also see students who majored in English or who majored in a humanity of some kind, or were a sociology or an anthropology or a psychology major. So it really varies. Many programs will outline for potential for individuals interested in pursuing graduate training, what are the course prerequisites? And so students do have to take certain science classes in order to enter graduate school. The purpose for that is really just to set students up for success. You need to have a genetics class at least before you can enroll in a genetic counseling training program. Many applicants also have experience doing research, volunteerism, counseling. Maybe they were a part of a peer counseling organization on their college campus. Maybe they were involved with the crisis text line. Maybe they were involved with a local area shelter providing counseling services for perhaps victims of domestic violence. People might have volunteer opportunity, experience working with rare disease organizations, participating in summer camps, all of that kind of stuff. And some people come in with research background too. Maybe they were really sciencey focused in the undergraduate career and they wanted to transition and think about the people side of the research that they were doing. And so it's some people come in with a lot of science research and others don't, and that's okay. But I think there's a lot of broad types of experiences that really give people opportunities to develop and experience skills that are transferable to genetic counseling. I'll say also people interested in getting involved in genetic counseling, having some kind of exposure to a genetic counselor in the field can be really valuable. Certainly for many years it was recommended to have shadowing experience, but programs very much recognize that that might not be possible. So there's lots of other ways to get exposure to the field of genetic counseling through webinars, through informational interviewing, maybe through reading a blog or listening to a podcast or participating in events that organizations hold where genetics professionals are presenting just the same. So there's lots of different ways where people could get exposure to this particular field. And I will say sometimes people are patients themselves. So sometimes students who pursue graduate training in this space, they have a personal connection. Either they themselves have a diagnosis or they've watched a family member go through genetic testing. And so certainly there are individuals with that lived experience as well, as part of, that in terms of like the full picture of when they decide to enter into the genetic counseling training space.
And how long is the training for example, at BU?
Sure. So accredited training so genetic counseling training programs are typically accredited by ACGC. That's the overseeing organization at this time. And in general, these programs are 21 months in duration or about 2 years. Many programs are full-time. Some programs are more flexible to have condensed class schedule that allows students to work a part-time job, for example. Some programs are even remote or hybrid-based programs. So there's a lot of different programs that exist out there. And one of the things that I always encourage individuals interested in going into this field to explore further are, what is the personality of that particular program? Where is it located? Is that some place where you see yourself? What do you like about what you've heard about this program or what you've read about this program on their website, for example? So there's lots of variability out there. The curriculum or the content that's taught in these programs is pretty much the same. There are nuances, not saying it's one size fits all, but but each program is going to go about things just a little bit differently.
Right. And can you talk a little bit about the need? You mentioned this about a workforce shortage, but what is the need for genetic counseling and specifically in the rare disease space? If you could talk to that.
Yeah, genetic counseling, certainly with so many discoveries in the field of genetics, there's new gene discoveries every day, and we're seeing a lot more with precision health and precision medicine. Understanding someone's genetic makeup maybe can impact their treatment or the medicine they end up taking. And so genetic counselors in the rare disease space can be really valuable to build a bridge between maybe a company that has a potential treatment, maybe there's a clinical trial, maybe there's an advocacy organization with the patients that this treatment or trial can benefit, and so the genetic counselor can help bridge that gap. Maybe there are more ways in which there's more genetic testing available now, and not that everyone who goes through the path of genetics gets testing, but to have a professional be able to understand the outcome of that test, explain that test result in a way that's meaningful, not only to the patients, but to the healthcare providers, because there's a shortage in clinical geneticists. And so we can often help translate those complex test reports to the healthcare provider as well. And we're just learning more and more, even in the, even with rare disease that maybe have certain ways in which you could take proactive steps towards lifestyle, et cetera, to prevent the manifestation of symptoms. And so how to identify those individuals and how to maybe communicate that to, again, other healthcare providers or individuals within the family. So I think there's a lot going on in that rare disease space too, with these newer treatments and newer understanding.
Right. Thank you. Yeah, it sounds like the field of genetics and geneticists and genetic counselors, there is definitely a growing need for more and more people in that space. And so in closing, I just wonder, is there any last minute advice you would have to young people who want to work in the genetic counseling field?
Yes. There's only going to be more and more learned and understood, and there's just going to be more and more options and genetic testing out there. And, we need people that understand it. We need people that understand the benefits of this testing, the limitations of this testing, maybe the drawbacks of this testing. There could be a lot of ethical pieces about this too. And so having individuals trained in this space can be really helpful in terms of developing policies, fostering, again, additional research, connecting people who have rare diseases together to help perhaps scientists understand more about the why behind why is this, how can we figure out, is there a gene even involved? And if we could find that, is there a way to treat it? We're seeing a lot more with gene therapy, which is a whole other ball of wax. So, I think we're just going to continue to see more and more discovery and development, and having that knowledge and that know-how can be just so valuable. This is one of the hottest careers out there. It keeps coming out in all of those sort of reports on up and coming careers. And so if you're really interested in this space, I would encourage you to, there's a number of, attend again. There's a number of podcasts or books or blogs, or reach out to the National Society of Genetic Counselors. They have a great website for people interested in this space. Obviously Rare New England does a lot of the virtual conference coming up is a great way to have experience too. So I think just, learning a little bit too about the far reach of this field can be helpful. And if I think there's lots of ways to get in there, because this is a really because it's a profession of growth and opportunity too.
Right. Excellent. Yeah, I think you're right. There's so much information you can learn. And I think Rare New England is having this virtual conference in a few weeks. And I think you can learn about that on the Rare New England site. And there's going to be people talking about subjects like this. And I think it's just a great way to bring education to patients and families and really the general public about rare disease and career possibilities. So we thank you so much for being here, Kathleen. I think I could talk to you for hours, honestly, but I love what you've been able to share. And I think that people watching this are really going to be in for a treat. So thank you so much.
Thank you, Lisa. It's been a pleasure.
Excellent. So before closing, we would like to explain to you our new Rare New England in Motion segment. We will be showcasing this video live on Facebook on September 24th at 5:30 p.m. You can tune in then to see Kathleen Swenson's show and interact with Kathleen and members of the Rare New England staff to have an interactive discussion online. We'll be able to answer any questions. If you have any questions for us, you can send us an email at info@rarenewengland.org. Please mark your calendar to tune in live for this show. Rare New England in Motion is the perfect way to expand upon our mission of engaging with our community. That's our show for today. From all of us at Rare New England and all the patients and families who keep rare disease in motion, thank you for watching. And remember, when you hear hoofbeats, think horses, then think zebras. Thank you.